You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, new breakthroughs in the treatment of gum disease. With us, we have an expert on the topic. He is DFW's periodontist, Dr. Bolchi. Dr. Bolchi, welcome back to the program.
Thank you, Randy. Thanks for having me back.
Now, we've had you on the program before.
Yes.
And we've been asking you to come back, I guess, for more than a year now. So welcome back. So before we get into today's topic, for people that don't know you, tell us a little bit about your practice. Who's your typical patient? And what are the different procedures you do?
Well, Randy, I'm a periodontist by trade, and so we specialize in the treatment of gum disease, dental implants. But just because of my background and teaching background, I've kind of become known as being the periodontist that does a lot of the cosmetic procedures.
Okay.
So
like cosmetic gum treatments?
Yes, cosmetic gum treatments, cosmetic dental implant procedures. We do a whole variety of treatments that fall within our practice, but those are the things that we kind of somewhat subspecialize in.
All right, now people don't like going to the dentist, right? And especially they don't like going to the periodontist. Do you hear that?
Yes, we hear that a lot because of people's
And how do they say it? How do they say it?
Well,
no offense, doctor.
No, yeah, I mean, people usually are very nice about it, but they do say that, we have heard either from friends or we have seen it on the internet that the treatment of periodontal problems or gum problems is very painful. And this is something I've been dreading for a long time, and I've been putting it off, and I don't want to do it. So this is the usual conversation that we have with patients.
So I guess the good news is, you say, and we've talked about it, no more bleeding gums, no more bad breath, no more loose teeth, with the use of some of these lasers for the right candidate.
Yes, and the laser gum treatment, which is what we'll focus on today as part of our topic, is something that is relatively new, but it has revolutionized how we treat gum disease.
Okay, so gum disease, how big of a problem is it, by the way? And then we'll jump in with the treatment options.
Gum disease is a huge problem worldwide. It's been estimated that about 80% of the adult population, 70 to 80% of the adult population has some form of gum disease. And from that 70 to 80% of it, half of those patients have advanced gum disease.
So what are the symptoms of gum disease? Somebody watching this, how do you know if you have it?
Well, gum disease, the symptoms are bleeding gums. That's the first and foremost symptoms that
like
patients
when you floss
find.
or
when you floss, when you brush your teeth. If it's really bad, you even have spontaneous bleeding of the gum tissue.
Really?
The other symptoms can be gum recession. One of the symptoms that a lot of patients come to us for is bad breath, because these bacteria that are in the mouth that are causing gum disease cause bad breath. Shifting of the teeth. If your teeth shift and you start developing gaps in between your teeth, that's another sign that you can have gum disease.
How is that connected to gum disease? I mean, help me understand that. And even bad breath, how is that connected to gum disease?
Okay, well, bad breath is based on the fact that bad breath is caused by bacteria. There are compounds in bacteria called the volatile sulfur compounds that cause bad breath. And so if you have a lot of gum disease, then which is a bacterial infection.
So under the gum line?
Yes.
Is an infection? Is that what you're saying?
Absolutely. Gum disease is an infection that basically you have a lot of bacteria under the gum line, and these bacteria produce these volatile sulfur compounds and cause bad breath.
Cause bad breath.
As far as the shifting of the teeth goes, that is related to the fact that these bacterial infections under the gum tissue. So what your body does in order to wall itself off, it's a constant war between your body and these bacteria in the mouth.
So how does that make the tooth loose?
Yes.
Well, that's the part I'm not getting.
Exactly. And your body, in order to wall itself off, is basically, it's like a constant war between them. So your body basically cuts its losses and then resorbs back, or sets back and takes away bone and gum tissue in the process, and lets the bacterial army have those assets, if you want. And so you lose more and more bone in the process.
So
teeth get loose, and when teeth get loose and lose support, then under the forces of the bite, they shift.
And this is, if caught early, you say it's an easy one to take care of, if caught early.
Absolutely. If it's caught early, then this is something we can treat. And we have studies that go 50 years. And 50-year studies have shown that if this is caught early and treated early, then there are two advantages. One, we can be much less invasive with our procedures. And two, we can maintain these teeth for the patient's lifetime. And again, there are 40, 50-year studies to back that up.
Okay, now back to, you mentioned gum recession and bleeding while flossing. Isn't that normal just to have a little bit of bleeding while you're flossing?
No,
Really?
that's not normal. I mean, that's a little misconception, is that, you can't have a little bit of bleeding and that's okay. Bleeding is not normal. Bleeding is a sign of inflammation. If you take an analogy, if you had bleeding from your nose, or you had bleeding out of your ear, or you have bleeding from your eye, you would go to physician right away. You wouldn't even wait 1 second. So the bleeding from your gums is completely not normal either. It's a sign of inflammation, and the inflammation is related to the reaction to the bacterial infection. So it is not normal and it should be treated.
So you treat gum disease as a bacterial infection.
Absolutely.
So there's two ways to get rid of it. Cut it out or laser it out. Is that true? Am I oversimplifying it?
Yes, a little bit. So the
Because
tradition.
I thought that's what you told me. That's why I said
Yes.
two ways to do it.
Well, yes, the traditional method of treating gum disease is to basically, this is the traditional method that
this
we
is
were
what you
all
do.
trained in. Yeah,
Okay.
this is what we were all trained in, is to go in and cut away the gum pocket. Either cut it away.
What does that mean, the gum pocket?
Okay, so as I explained, is that every time you have a bacterial infection and you lose bone and gum tissue, the pocket around your gum tissue is getting deeper and deeper. So you have a pocket.
space around the tooth.
Space, yeah,
Okay,
the space,
okay.
the crevice around that forms between the gum tissue and your tooth is getting deeper and deeper, because these bacteria are literally eating away at the bone and on the gum tissue. And so what happens is that as it's getting deeper, more and more bacteria are getting in there, so it's just like a devil's circle. It's getting worse and worse all the time. So you would go in and we would basically have to open the area by incisions, by cutting on the gum tissue, peeling the gum tissue back, cleaning everything out, and then putting stitches in. And the patients would go home, and then we would have a lot of post-operative discomfort from this procedure.
So it's painful.
And yeah, it would be painful. And that was something that people would associate with gum treatment, so they would put it off. And they would hear it from friends and family that would have it done. And so that treatment, after my initial training, especially since I focused a lot on cosmetic periodontal procedures, never appealed to me. So even
You told me that because I said I wanted you to come on to talk about gum disease because it's hot in the press and links to heart disease and diabetes. And you said, Randy, I don't like doing traditional treatment.
Yes, I've never liked treating traditional treatment just because to me
why?
it was disfiguring. It went against almost my credo.
What do you mean disfiguring?
Well, disfiguring means that you would have to cut away gum tissue to get rid of this infection.
Because it was diseased?
Yes, it was
Okay.
diseased. So you had to remove this diseased gum tissue by literally cutting away at it. And by doing that, you would get longer teeth that would be more sensitive. So you would actually create more recession in the process of treating the gum disease. And it was unfortunately a side effect of the treatment that was inevitable.
And
with
that goes on
traditional
every day.
treatment.
That goes on every day.
That is still being done, and that goes on every day.
Cutting out gum disease.
Yes, sir. Yeah,
Okay.
that's still going on every day.
Interesting. So lasers, though. So how have lasers changed everything in a way? You say it's an exciting time.
Yeah, it's an exciting time, and the exciting time is that now, just as like in general in medicine and in dentistry in general, we're going more and more to minimally invasive procedures, because we have found that the less invasive we are with the procedures we do, the more the natural healing forces of the body can take over and take care of the situation. And so what the laser does, it allows us to treat this bacterial infection by going directly to the
Are you
source.
killing it with the laser?
Yes, the laser has got basically the light energy that the laser has is absorbed by these bacteria and absorbed by basically the color of the bacteria.
Has a color?
So the bacteria are pigmented. And so
Okay.
the bacteria that cause gum disease, they have got pigmentations. And this pigmentation, or the color of these bacteria, gets absorbed, is basically an attractant for the laser light. And so the laser specifically kills this bacteria without causing any collateral damage to the tissue. By doing that, we can be much less invasive. So we don't need to do huge incisions. We don't need to peel the gum tissue back. We can just go into the area in between the gum and the tooth and let the laser clean out this area and kill the bacteria. It's almost like you're sanitizing the area with the laser.
So you think it's as effective as the cutting and the stitching, or as effective and better?
Well, I think it's better and as effective. Not only is it that, because it's also much more predictable, because we're now being much less invasive. So it is a treatment that is not only more comfortable for the patients, but it's also more predictable, because you're not opening up the gum tissue in a huge manner and basically removing blood supply to an area that needs to heal. You see, every time you make an incision and you peel the gum tissue back, you're actually cutting away the blood supply that you need for the healing process.
Okay.
And so by doing the laser, you're removing the infection without the disadvantage of taking that healing forces of the body away.
Okay, now I've had periodontists on the show using lasers, and they swear by it. They say they can't believe they ever did it the other way, or they could never go back to the other way. Elaborate on that. I mean, do you have other friends, colleagues that feel the same way?
Yeah, absolutely. More and more periodontists are starting to use the lasers for the treatment of gum disease because they have seen the advantages. And there's, just to tell you a personal story, a friend of mine who is a periodontist in Miami, recently one of his referrals, who is a dentist, moved to the Dallas area. And he was telling me the first thing he asked, do you use lasers in your practice? And I said, yes. And the second thing he said, I'll tell you what, I had been putting off the treatment of gum disease because he himself had gum disease. He had bleeding gums. He's a dentist.
Bleeding gums.
And he had bleeding gums, and he said, I'd been putting that off because I knew how the treatment was, how invasive the treatment was, so I had been putting it off. And then when this laser came about and I had it done, I tell you, it was a world of difference. Now I have no bleeding, and it was the most comfortable procedure I had done. So that was the first thing he asked when I met him here in Dallas, moving from Miami.
Okay.
So this is something that more and more periodontists are doing as well. And definitely, if as a patient you do have the signs and symptoms of gum disease, then you should seek out a periodontist who does use the laser to treat the gum disease.
Okay, and now also, in the older, I'm calling it older, even though it's done every single day. Okay, so in the standard procedure for gum disease, treating this bacterial infection by going in and cutting around the gums, but aren't you leaving a lot of the infection behind when you do the cutting procedure? I mean, is there not? Do you think? Are they treating it the same way? I mean, is it a philosophical difference?
Well,
cutting versus the laser. I mean, one thinks maybe it's not a bacterial infection. I mean, help me understand that.
Yes. Well,
why isn't everybody doing it this way?
Yeah,
that's my question. Also.
Well, the reason is that because the traditional way of treating gum disease, it's still treating the infection, but the way you do it is that you peel the gum tissue back and you scrape whatever you see of the infection, which is hardened bacteria or tartar on the root surfaces. Whatever you see, you scrape that off of the root surfaces. So that is the traditional method. But to your point, there may be bacteria left in the pocket of the gum tissue that you're peeling back. Now, whenever we make our incisions, we try to cut away that pocket, but you can't see the bacteria. So you're kind of guessing.
So with the laser, by the way, is it also, I guess people that have a tendency to get this gum disease, get it back, does it seem to keep it away longer when you treat it?
Well,
with the laser?
Yes, obviously no treatment in medicine is 100%.
Okay.
But from what we're seeing right now is that the recurrence of the disease seems to be much less. Obviously, the recurrence has to do with the fact that as a patient, no matter what treatment you have done, whether laser treatment or surgical gum treatment, you still need to follow up with maintenance. That means you still need to brush your teeth and floss your teeth and go and get regular cleanings. It's not like you can have a laser treatment done and it's a one-shot deal and you're done. So,
but okay, the people with, so they're flossing and they're getting some bleeding. You say it's a chronic infection. Bad breath, an infection of the gum line. Okay, so you laser around the mouth. How soon before these things go away? In a perfect world, I mean, what have you heard? What are some of the stories patients are saying? How soon can that bad breath go away?
Well, the first and foremost thing that we hear right away is several things. One is the first thing is that we call patients after their surgeries the evening of or the next day. The first thing we hear is that I'm not having any pain, any discomfort. I can't believe I put this off for so long. I'm just, if anything, I took one Advil or a Tylenol just because I thought it should hurt. But that was just me. I wouldn't even have to take that. So that was the first thing. The second thing that we hear is that as in the first couple of weeks after the procedure, their bad breath goes away because now you've cleaned out all the infection and it's gone. And the third thing we hear is that their energy level goes up. Because you see, if you have a...
Why is that?
Well, if you have a constant bacterial infection in your body, and your mouth is obviously part of your body, and that bacterial infection is seeping into your bloodstream via the blood vessels, via the capillaries that you have in your gum tissue, via the small blood vessels. So it's seeping into your bodies. That's why there's a link now between heart disease, respiratory disease, rheumatoid arthritis, all those things with gum disease. So if that's happening, then your body is fighting that off. And
so when you kill the bacteria,
that fight goes away.
Interesting.
And if that fight goes away, then what does that do? That leads to more energy for your body. And so people immediately, within a week or 2 weeks, they feel their energy levels going up because their body is not fighting that constant infection. So those are some of the things we hear right away. And by the way, with this procedure, even if you have it done on one day, theoretically, you can go back to work the next day. So this is something.
So the other procedure, standard procedure?
The standard procedure was not like that. With the standard procedure, I would tell patients that if you have this done on a Thursday or so, then you can go back to work on Monday. But with this procedure, and it's not like you'll be bed-bound, but you should take it easy and you could be at home. But with this procedure, you can go to work right away.
So hot and cold sensitivity, things like that, also could be gum disease?
Oh, absolutely, yeah.
And that goes away too, the hot and cold sensitivity?
Yes. What hot and cold sensitivity is the fact that basically the gum tissue pulls away from the teeth, so you get more tooth root exposed.
Interesting.
And so the tooth root that is exposed is not meant to be exposed to the environment of the mouth. So anything hot and cold that hits it goes more to the nerves of the teeth, and so you become hot and cold sensitive. With the treatment of the gum disease, then the gum tissue stabilizes, and then with time that hot and cold sensitivity gets better, because now all of a sudden you don't have as much exposure of those root surfaces.
One of the things that, we talked on the phone, you say this is more than just gum disease. This is about smiling. This is about dating and having fresh breath. It's about the smile. You're a dentist, of course, a periodontist. Of course you think the smile is important. How important is the smile?
Well, in
your view.
Yes, I mean, we talked about this last time as well. The smile, there have been studies done of, if you look at an individual and from a regular folks, what do you find to be the most attractive part? What do you look at first? And the two things that always come up first are the eyes and the smile. So there's so many rhinoplasties being done. There's so many nose jobs being done, but nobody really looks at the nose. Everybody looks at the eyes and the smile. So the smile is one of the most important features for somebody.
Do you find that after these gum treatments, people are smiling again?
Oh, absolutely. They're smiling for several reasons. One, as I explained previously, their energy level goes up. So they're smiling because of that. Then their bad breath goes away. People are not afraid to go out and date again. People are not afraid to basically talk to their colleagues because they don't have a bad breath, or their partners. They don't have a bad breath anymore. So that's one of the things that they can immediately smile about. And the other thing is that because with this laser gum treatment, we can treat gum disease in a minimally invasive way to where it doesn't cause gum recession.
Could somebody be too far gone? They've been told they have these big pockets. Could a periodontist or a general dentist argue and say, I don't know, that there's not enough evidence that these lasers work yet? Could somebody say that?
Well, somebody could not say that there's not enough evidence that the lasers work, because we have plenty of evidence.
But do they say that? Do they say that?
Oh, absolutely. There are many dentists out there.
I
and
spoke
even
to a Dr. Heller,
yeah.
as a matter of fact. He says, Randy, there's not enough evidence yet.
Yes.
At least for him.
Yes. People do still say that, but if you go and read the research articles very carefully, the research is there. I was actually one of the ones who was on the fence with this laser treatment for a long time. I was skeptical because we as periodontists, we are trained to be very evidence-based. We are trained to be very research-oriented. But nowadays, there's so much research out there on this topic that is very convincing. As a matter of fact, respected clinicians like Dr. Stephen Brown from Philadelphia, or several of the periodontists who are on the board of directors of our governing body, which is the American Academy of Periodontology, are using lasers. So more and more periodontists are evaluating the research and seeing that it has shown to be effective, and basically starting to incorporate lasers into their practices.
So is the message, if you had to say, that if you've been told you have gum disease, look for a dentist that has, a periodontist specifically, that has a laser?
Absolutely.
You believe
absolutely.
that?
I believe that full-heartedly.
Does it cost more to go to a specialist, though?
No, it doesn't. It doesn't cost more to go to a specialist.
Do you have a bias? Do you
not.
believe that everybody, if you have gum disease, you might as well go to a periodontist?
Well, obviously,
I guess general dentists have lasers too.
Obviously, yes. Obviously, I have a bias. Number one, there are different types of lasers. So a lot of the lasers that general dentists have may not be suited to treat gum disease. There are lasers that are specifically done because of the specific wavelengths of the lasers that have specific protocols to treat the gum disease. As a matter of fact, you have to have special training in order to be able to perform laser gum treatment. So not all lasers are alike. That's the first thing. And the second thing is that if you wanted to have heart surgery, you wouldn't necessarily go and see your internist, because that's not something he or she does day in, day out. And the same thing with the treatment of gum disease. Although more early forms of gum disease or mild form of gum disease are treated by general dentists, and the majority of them do a good job.
But they could go to you. I mean, if you have the early signs of bleeding.
Absolutely.
Now, is it true about men? I mean, they put it off. Everybody puts it off, right? Until they can't eat or chew.
Yeah, absolutely.
Right?
Yeah.
Is that when they usually end up in your lap?
Well,
when it's just really bad?
Well, unfortunately, yes. And that's why I think you're doing a great job with your show in educating the public to the fact that the earlier people see these signs and symptoms of gum disease, and the earlier that we can treat them, the more the chances and the better the chances that they can keep their teeth for a lifetime.
Now, are you of the opinion, I don't want to put words in your mouth, but if somebody has bleeding gums, bad breath, maybe teeth are loose, if they have gum disease, are they headed for disaster? I mean, are those people, in your opinion, headed to lose their teeth?
The majority of
Is that what you think?
Yes, and it's not just what I think, it's what studies have shown. Studies have shown that if you look at patients who have gum disease and who postpone treatment and who don't get any treatment and don't follow up, that they lose their teeth at a significantly higher rate than patients who do get gum disease. So that has been scientifically proven, and not just in the US, worldwide.
So if it kills this bacterial infection, okay, and after we had our initial pre-production meeting on the telephone, I'm thinking, well, why not in the future, every dentist in America, just on the 6-month checkup, to go around the mouth with a laser and kill this bacteria before it gets big?
Absolutely.
Do you think that'll happen someday?
Absolutely. I think that's where we are headed. I think
so I'm not the only one with that idea.
No, absolutely not. I mean, I think that, obviously you have been doing so many health shows that you are more in the know than the general public. But absolutely, this is where we are headed. I firmly
so like the
believe
hygienist at what, a lower setting?
Absolutely. There will be new lasers that will be coming up to where when you go in and get your cleaning, instead of getting your gums scraped, as it's being done now by the hygienist, that everybody will go in and that the gum cleaning or the deeper cleaning or the regular cleaning will be still a minor part of it, but the laser will be a major part of it.
But why is it, how could loose teeth become no longer loose? Is it because the gums are holding onto the tooth better after the treatment? That's the part I don't get.
Yes, because if you have basically gum tissue that is inflamed, if I can put an analogy out there, it's like the difference between hamburger meat and steak meat. So you see how hamburger meat is very kind of spongy and very loose, but steak meat is firm. So if you have an inflammation around your gum tissue is like hamburger meat. As a matter of fact, that's the way we refer to it. When you treat the infection and get rid of the infection, it firms up, it becomes steak meat. And steak meat is much firmer.
But if they've lost bone though, it's too late at that point.
Well, yes and no, because what we have seen is that with this laser gum treatment, a lot of times when the infection is removed and the body given a chance to heal, that a lot of times the bone regenerates and basically we get bone regeneration. Now, it doesn't happen every single time, but we're seeing major bone regenerative cases that are being published now. So this is happening more and more because now you're giving the body a chance to heal itself. It's almost like a holistical approach of treating gum disease.
And it's inexpensive for the most part, if caught early.
Absolutely. If you take the...
And they could go to you first. I mean, you're a specialist, but they could go to you at the bleeding gum stage.
Absolutely.
Stage.
I would love to see patients at an early stage because that's when then we can be most effective.
How long would it take, by the way? So they go in your office at an early stage. Ideal situation.
If they come to me at an early stage, then the treatment can be a 30-minute, 1-hour laser treatment. And with that, then they are basically have gotten rid of their bacterial infection, and all they need to do is brush and floss regularly and keep up their regular cleanings.
So laser, is this called laser dentistry? I mean, is it laser, look for a laser dentist?
It's called laser gum treatment.
Okay.
And again, look for a periodontist that does this, and look for a periodontist that does the correct type of laser that is got FDA approved, that is backed by research. And you can research this online, and because there are different types of lasers and different types of wavelengths. But look for a periodontist who does this treatment because this is the way of the future. I firmly believe that.
Well, I love what you told me in the green room. And people need to know this is a real interview. I'm not trying to endorse you or side with you, even though your argument here is very convincing. But you said, Randy, as a periodontist, we're treating the gum disease, and I didn't like doing the traditional treatment.
Absolutely, absolutely.
But you like doing this
absolutely
laser treatment.
I have found a new excitement for treating gum disease because of this. As I told you, I had actually started in my own practice doing less and less of the invasive procedures, just because the result was just counterproductive.
You said your own family or whatever, you wouldn't want to do what the cutting procedure.
Not just on my own
standard.
Yes, if I were to have gum disease myself, I would not want to have the standard surgical procedure done on me.
You wouldn't?
No way.
You'd get a laser?
No way, absolutely. I would find a periodontist, a colleague, and thank goodness now we have more and more of them who I can call on. If I had gum disease, I would call on the colleagues who have got this laser treatment, and I would let them treat me. Just like this dentist friend of mine from Miami who moved here, he had the same experience. So this is something that if you talk to a lot of dentists who are in the know, they will tell you that's exactly what they would do.
So no more bleeding gums, no more bad breath, no more loose teeth. Teeth are starting to shift. You could stop that.
You could stop all of that, yes.
Is that right?
Absolutely.
And you say, and I know this is a big topic, but you say smokers, and there's a lot of people with zero symptoms, and they have it.
Yes, unfortunately, gum disease is not something that's painful, so it doesn't cause pain. And a lot of people just associate pain as the only thing that's causing a problem. But it's these subtle symptoms that we talked about as bleeding gums, shifting of teeth, gum recession, bad breath, those kind of things that patients should look out for. And those are the things that if patients come to us in an early phase, we can treat very, very effectively.
Okay, great. I want to thank you for coming to the show. Very interesting.
Thank you, Randy.
Thanks for coming back.
I appreciate you having me on your show.
And your website is pretty comprehensive. They could go there, learn more.
Absolutely. People can go on our website. It's www.drbolci.com. And we have all sorts of information, testimonials from patients who have had this done, and schematics of how it's done. And so there's a lot of information there.
So you think you're going to be known as the go-to guy in Dallas for gum disease? Are you going to wipe out gum disease in Dallas?
That's certainly
your secret goal?
That's our secret goal, absolutely. And we want to do it in a minimally invasive way to where patients are very comfortable in having it done.
Okay, great. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, visit our website at wellnesshour.com and just put in gum disease, Dallas, or Dr. Bolci's name. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.
Hi, I'm Randy Alvarez, host of The Wellness Hour. We are currently looking for licensed health practitioners to be on the show. So if you have something to say, a great message, a new breakthrough, you have to let us know about it. Visit wellnesshour.com, click on how to become a guest, or just email me directly at randy@wellnesshour.com. If you know a doctor that you think would be great on the program, send them my way. We'll see you here.